So I am Dr. Ashwini Kumar. I am from Mahavir Netralaya. 13 years back, I was the best eye surgeon there.
Okay.
But a brain hemorrhage made me paralyzed.
Oh.
So I couldn't work. My left side is paralyzed.
Oh.
So with one hand, I couldn't operate.
Okay.
So with sobbing, I went to Shankar Netralaya, Chennai.
Okay.
There I learned a new technique of visual rehabilitation.
Okay.
So that I can do with one hand.
Oh, wonderful.
Because I was just almost losing the job because hospital won't keep me for anything because I had no patient. So I learned it from Shankar Netralaya, Chennai. I went there alone for 1 month training. Thereafter learned from LV Prasad also. There Pradeep Bagga was there, must be knowing. So he taught me lots of things.
Very
Deepak Bagga, right? Deepak.
Very
So
good.
right now I will start my presentation. Pointer is there.
No, you can
Who will
just
change the slide?
Yes, next change. Here, Somen, you stand there and go and change it. You will do. Okay, thank you.
You can see this is one patient. He had coloboma of eye. You can see his eyes. So for near, I gave him the illuminated handheld magnifier. It has illuminated hand magnifier, means it had inbuilt light. The next one is, it was one video was there. Will it run? No.
Run the video.
Run the video. Just a small video is there.
Yeah, no problem.
If it's run good. अलग से भी उन्होंने डाला था, अश्विनी कौर में डाली थी।
How many speakers more?
Only, sir.
Okay, it's not running now. So no problem.
Sir.
I'll just speak. The video is not running, very sorry.
Okay, no problem.
So the low vision, as you know, is the term to use to describe the significant visual impairment that can't be corrected with glasses, contact lenses, medication, or even eye surgery. It includes loss of best corrected visual acuity. Best corrected visual acuity was worse than 20/7 in better eye. And there was significant visual field loss and tunnel vision. That was lack of vision in the periphery, and blind spots are examples of visual field loss. So disability statistics from American survey shows that 2.3% of individuals ages 16 over have a disability or low vision. Next one. So the place was Mahavir Netralaya, Patna. You can see there were very less patients because at that time nobody knew about the visual rehabilitation. So I had very less patients. So the period was December 2018 to March 2019. I did the complete history of the patient, clinical examination and lab investigations. The investigations were visual acuity, Snellen's chart for the distance, near vision chart, color vision with Ishihara, and ocular movements as well. There was slit lamp movement, not to forget. Next slide, sir. The spatial interest, as you can see, this is my room. When you enter my room, you will see this board that the patient will get a feel that they are at the right place. So the newer instruments like monocular and binocular telescope for the distance vision, and for near, I use handheld magnifier, and then illuminated and non-illuminated pocket magnifiers, dome magnifier, half eyes cutaway. Treatment was different kind of magnifiers were given for the visual correction and improvement. And M training, this is very important. M training means you make big M with rotating your neck so that you can see the periphery. It's for the tunnel vision patient. You can make a big M so that you can see. The next one was the Notex to recognize currency. It's a sheet of paper, sheet of cardboard. It has corrugations and cut marks. So the blind person will feel the cut mark and he remember the denomination. Then he can see that the problems identified were 3 had retinitis pigmentosa, 1 had coloboma, 4 had nystagmus, 6 had Stargardt disease, and 4 had corneal opacity. Diabetic retinopathy has 4, amblyopia was 1 patient, and central CS retinopathy has 4. Next slide. The result you can see from PL/PR to 6/16, 8 patients, and counting fingers of 6/16, 6 patients, and from counting fingers 6/36 in 3 patients. 6/66, 36, 9 patients. There were no improvement in 4 patients. We had total 36 patients. Most patients were satisfied. Now, what was the improvement in quality of life? First one was reading newspaper. Second was doing home and office work. And the child was able to read blackboard and give exams. Improvement in walking and independent through M training. Handling money. Improvement in household and cooking course. Like I go to the home also to train the people how to make the rotis. Like they can't make the rotis with one hand magnifier. So I go their home. I change the light source. I tell them to use the special utensils with them. So I'll change the source of lighting also. So these things I have been doing. Next one is, so this you can see, this is a different types of ways I can do this. And these magnifiers are not for the whole life, because after 6 or 7 months, with some brain adaptation, they will see much better. Not 100%, but they will feel better.
Very nice.
So, sir, this is was my presentation. Thank you so much. I asked
Thank you.
Dada for my better future, because he has been.
Thank you.
I remember his one thing, Dada. I had my first conference at Ravi Prasad Bhubaneswar. I was shaking, Dada की करे जाबो हम कैसे जाएंगे अकेले? He said, Ashwini, हारा वही है जो लड़ा नहीं.
Wow.
And I remembered that, Dada. That gave me the.
Right.
Thank
Thank you. Thank